In the year 2035, the landscape of mental health care had undergone a radical transformation. The stigma surrounding mental health had significantly diminished, and the world had seen a surge in breakthrough treatments and therapies. The most significant change, however, was the universal accessibility and affordability of mental health services, a feat that seemed almost impossible just a decade ago. The journey towards this transformation began in the early 2020s, when the world was grappling with the aftermath of the COVID-19 pandemic. The pandemic had not only exposed the fragility of global health systems, but also underscored the importance of mental health. The isolation, fear, and uncertainty had led to a surge in mental health issues worldwide, prompting a global conversation about the need for accessible and affordable mental health care. In response, governments, health organizations, and tech companies began investing heavily in mental health research and innovation. The first breakthrough came in 2025, when a team of neuroscientists at Stanford University discovered a new method to map the human brain's neural pathways. This breakthrough allowed for a more accurate diagnosis of mental health disorders, leading to more effective treatments. The next significant breakthrough came in 2027, when a biotech company, Neurogen, developed a revolutionary gene therapy for mental health disorders. The therapy, based on the CRISPR-Cas9 gene editing technology, could modify specific genes associated with mental health disorders, effectively curing conditions like schizophrenia, bipolar disorder, and major depressive disorder. The therapy was not without controversy, but after rigorous testing and ethical debates, it was approved for use in 2030. While these breakthroughs were promising, the challenge of accessibility and affordability remained. Mental health services were still out of reach for many, especially in low-income communities and developing countries. However, the advent of digital technology and artificial intelligence provided a solution. In 2031, a tech startup, MindAid, launched an AI-powered mental health platform. The platform used machine learning algorithms to provide personalized mental health care, including diagnosis, therapy, and follow-up care. It was accessible via smartphones, making it available to anyone with an internet connection. The platform was also affordable, with a sliding scale payment model that made it accessible to low-income individuals. MindAid's success prompted a wave of similar platforms, leading to a digital mental health revolution. By 2033, AI-powered mental health platforms were the norm, providing accessible and affordable mental health care to millions worldwide. Governments also played a crucial role in ensuring accessibility and affordability. In 2034, the World Health Organization launched the Global Mental Health Initiative, a program aimed at integrating mental health services into primary health care systems worldwide. The initiative provided funding and resources to countries to develop and implement mental health policies and programs. It also advocated for mental health insurance coverage, leading to legislation in many countries that required insurance companies to cover mental health services. By 2035, the future of mental health care had arrived. Breakthrough treatments and therapies, coupled with universal accessibility and affordability, had transformed mental health care. Mental health disorders, once considered lifelong conditions, were now curable. Mental health services, once a luxury for the few, were now a right for all. However, the journey was far from over. Challenges remained, including the need for ongoing research, the ethical implications of gene therapy, and the digital divide that still left some without access to digital mental health platforms. But the progress made was undeniable, and the world was optimistic about the future of mental health care. The story of mental health care in 2035 is a testament to the power of innovation, collaboration, and advocacy. It is a story of how a global crisis can lead to global change, and how a once stigmatized and neglected field can become a priority. It is a story of hope, and a reminder that the future of mental health care is not just about breakthroughs and accessibility, but also about compassion, understanding, and the recognition of mental health as a fundamental human right. Subscribe.